All right, guys. Hey again, this is Alex Harris from NACC, and I am just going to go ahead and close out some of these slides and go ahead and get us started. Okay. No, I don't want to say this. Okay, so thank you guys so much for being on today. I know you guys probably have pretty packed Monday afternoons. Mondays tend to be a little bit busy, so I'm really appreciative that you guys took the time to join us for this webinar and really get the chance to connect with other young professionals that are at health centers and primary care associations, and of course, those of us who are at NACC. It's a really good opportunity just to kind of share some ideas and thoughts and just really work to build this network, which is our primary goal with all of this. So, like I said, I'm Alex Harris. I work as the Grassroots Advocacy Manager for Special Populations. I'm here at NACC. That's in our Public Policy and Research Division. And today we're going to do sort of a NACC 101. It's going to be pretty informal, and you're going to hear from some of the young professionals at NACC about the different divisions and what some of those divisions work on primarily, what their priorities are, what their goals are, how they work together, and what some of the major projects and themes they look at are. So I've asked a few folks to join me today to talk about that, and we're going to go through the agenda in a second. But first, I kind of want to talk about how we came up with this idea and what the real purpose of having this webinar and really trying to build up the Young Professional Leadership Exchange is. So first of all, you see my name up there on the slide, but you also see Liz Zepko and Russell Brown, who are my two peers in this YPLE effort, which is really our effort to build up the young professional community around health centers and community health. And just, you know, this is kind of our, just a really quick announcement. This is kind of our blurb about why, you know, we think that it's important for young professionals to be networking in this field. We feel like the healthcare arena is changing really quickly, and health centers are growing and becoming a bigger part of the health center or the healthcare system. And so we want to make sure that, you know, the younger generation that's working in this field can collaborate and work together to learn how we can really build up the health center movement and move it forward. You know, we've had some amazing pioneers in years past. 50 years now the program's been around, and so now we're looking to the next 50 years. You know, what is our vision for the future? How do we want to be involved, and how can we develop professionally within the health center movement are all questions that I think we're all dealing with. So a really great opportunity just to sort of brainstorm and connect with our peers who live across the country and we might not be able to see often, but who come together for some of our major NACC conferences. We have these receptions at most of our conferences, and so the upcoming reception is on Friday, March 18th from 6:30 to 8 at Petite Slots. I don't really know how to say that, but you can see the name up there, which is in DC. It's not at the Policy and Issue Forum Hotel, but it is nearby. So if you're coming to the PNI or you're coming for Hill Day, please definitely stop by Petite Slots at 6:30 so you can meet us and so you can meet some of the other young professionals who are working at health centers and PCAs and other organizations that work closely with health centers. It's a great group of folks. But Liz, Russell, and myself got started working together about last summer, and we were really excited about the receptions that the Young Professional Leadership Exchange typically holds at our major conferences. But we kind of wanted to amp it up a little bit and just learn a little bit more about really what are some of the expectations young professionals have in this movement, and what are some of the things that they're excited about, and what are some of the challenges that they're facing. So to give a little bit of context, at our CHI conference, Community Health Institute, last August, we had a pretty informal discussion group. So we kind of spread the word online and invited some folks who we knew were interested in this issue, and got a room at CHI and just sat down and talked about, you know, what some of the things we were interested in as young professionals in the health center world. We had an amazing conversation, and you know, again, I think one of the most valuable parts of that was we got to know each other and what each other's passions and interests were. But we also put some pen to paper on some ideas and some things that we were really interested in. You can see a little bit of a summary of our notes up here on the screen. But one thing we talked about was the vision. You know, what is our vision for the future of health centers, and what are we excited about? You know, what is, you know, our goals for what we're doing in our roles at health centers, but also other things we want to do for health centers. So people talked about the importance of payment reform and funding, social determinants of health. That came up a lot. Care for veterans was a big issue people wanted to see, you know, happening more in the health center world. And then people wanted to talk a little bit about health center branding and how do we sell health centers really to the community. We also talked about motivation. So why are people, you know, doing this work? A lot of times, you know, you get together with people who work in nonprofits, and there's, you know, there's always some passion there, and there's some commitment to social justice. So we talked about why a lot of us, you know, are working in this world and what's motivating it. And so we talked about the difficulty navigating the healthcare system and how health centers can really help be a good response to that. You know, we love how health centers treat the whole person. We had somebody who was a former health center patient and who, you know, grew passion for the health center movement because of that. Experience abroad was a big motivation, understanding how difficult healthcare can be to access and how health centers can kind of be the solution to that. And then, of course, serving special populations, which is a big passion of mine, but specifically serving the homeless and addressing homelessness was a big passion. So a lot of different motivations, but definitely a commitment to improving the healthcare system and to social justice. We also had some conversations about different opportunities for, you know, how we can work together and how we can learn from each other and how NACC might be able to play a role in this. So we talked about doing peer-to-peer groups, video chats and calls. We love the idea of doing like a retreat at some point or having some YP sessions at our conferences. There are a bunch of different ideas, but the one that really stuck in my mind and was part of the reason that we're having this webinar today, somebody said, you know, I'd really like to get involved in NACC, and I'd like to really learn how NACC works. You know, what does NACC do? How does it work? I just want to learn more about this organization. And so I was like, well, that's something that we could do, and we can check off our list, and it's a good excuse for us to connect with each other and be able to share ideas and inspiration with each other, too. And, of course, we have the challenges here, you know, being a woman, balancing family and career, always important. And then difficulty advancing, which I think was the biggest thing that we heard. And so, you know, a lot of what we're trying to focus on in these discussions around young professional development is how do we find opportunities for professional development in this world? You know, what are the skills that we need to advance, and what is the knowledge we need to have to do that? So just be thinking about those things as we're going through this webinar. I'm hoping that you guys will learn some stuff about NACC and what we do, and of course you're learning straight from the young professionals themselves. But I also hope that you take this opportunity to ask questions. So let me say this. If you have a question, a little bit of housekeeping, please put it in the chat box. Everybody is muted right now just because we get a lot of background noise if we don't mute everyone. But if you do have a question, please put it in the chat box, and we can either unmute you directly or we can just answer your question that you wrote. So be thinking about your questions for us about NACC, but also, you know, about, you know, what you want to know and what you want to do as part of the Young Professional Leadership Exchange, and what your goals are as a young professional, and what are some of the professional development opportunities and potentially opportunities that NACC could create that would be helpful to you. This is supposed to be a pretty open dialogue, and obviously webinars are sometimes a little tricky in terms of creating that dialogue, but I want you guys to feel free to voice your opinions and suggestions for us, because we're obviously just getting started and we're still learning, so please don't hesitate to reach out. All right, so just a brief overview of the agenda. Obviously, I just did a quick introduction. We're going to hear from Alyssa Shinto and Luke Ertl in our Public Policy and Research Division, also known as the I Street Office. Then we'll go to Liz Zepko from the Training and Technical Assistance Department. And from there, we'll go to Russell Brown in the Community Health Corps Department. And then we'll end with Zach and Daryl from our Membership Marketing Department. So you'll get a little, you know, those are various departments throughout NACC. You'll get a pretty broad perspective of some of the work that we do. And like I said, you know, at any point if you have a question, go ahead and put it in the chat box, and we'll try to get to all the questions. So I'm going to go ahead and turn it over to Alyssa and Luke, who are going to tell us a little bit more about the Public Policy and Research Division.
Hello, everyone, and thank you for joining us here today to learn a little bit more about NACC. I am Luke Ertl. I'm the Program Associate with our Division of Public Policy and Research, and of course joined here by Alyssa Shinto. We'll be talking a little bit about our DC office, and then I'll hand it over to Alyssa to talk about some of our departments in specifics, more in specifics. But to kick things off here, let me switch slides. Bear with me one moment. Okay, we're located at 1400 I Street, right in Washington, D.C., downtown D.C., about 2 blocks from the White House. That's strategically located so then we'd be close to Capitol Hill and close to where policy is being made for our policy department. We have approximately 20 staff, and as of right now, we have about 6 interns as well. The goal of our or what we work towards here in our division is providing in-depth analysis of key legislative and regulatory issues affecting health centers. We're comprised of 5 different departments within our division, with federal affairs, grassroots advocacy, regulatory affairs, state affairs, and policy research. So to go ahead and talk a little bit about federal affairs, grassroots advocacy, and regulatory affairs, I'll turn it over to Alyssa.
Hey everyone, thanks for listening in today. Again, like Lou said, my name is Alyssa. I'm with the Federal Affairs Department. Just a little overview of Federal Affairs. We are the voice on Capitol Hill throughout the year, so essentially the lobbyists who are speaking with legislators. And yeah, we represent the health centers, the patient staff, and communities. We have different priority, our foremost priority issue is funding, 330 funding. But we also deal with a range of issues from behavioral health to the 340B program to HIV/AIDS to the National Health Service Corps. So again, we are all over the place with issues. And yeah, we facilitate advocacy with the grassroots advocacy team. We want to activate our members, our advocates on the ground. And we also build coalitions or have coalitions with other stakeholders in DC. So for example, stakeholders that have interest in Medicaid. We are part of the Partnership for Medicaid. We also are part of a 340B coalition. So again, we work with legislators and work with proposed bills. We analyze policies to see how they will impact our health centers. Going a little bit further to the right, we have regulatory affairs. I'm going to skip over grassroots. I'll get back to that. So regulatory affairs department, we review and comment on agency policies, and these agency policies are from CMS, for HRSA, BIPIC, all these different agencies, and Colleen and Susan, they are the mighty two in regulatory. So yeah, they also support the PCAs, and our health centers submit comments. We usually have draft comments out that that health centers can configure to their own population or community, and yeah, and then they also interpret the legalese about policy issues. So hold on one moment. Yes, let's see. They are dealing with a number of issues. So right now they are doing a lot of comments and collaborations for 340B drug pricing program, meaningful use, FTCA, and 330 program requirements. Let's get back to the grassroots advocacy. Alex, feel free to chime in because you probably know a lot more than I do, me coming from the Federal Affairs Department. But grassroots advocacy, they work with advocates on the ground, building public awareness and building our support for our health centers. They have a campaign right now, it's Access is the Answer. They also have the Hispanic Advocacy Program for that specific population. And they provide webinars and teleforums for advocates to show them how to contact their elected officials, how to sign letters of, get people to sign letters of support. They also use social media. Dorian does a great job with using social media like Facebook, Twitter, and I don't believe they have an Instagram, but yes. And
we're working on that.
Yeah, they're working on that. Yeah, so Alex, do you have anything else you want to add to that?
I think you covered it really well. I mean, you know, I could talk all day about what we do in advocacy, but that's a really good summary, so thank you guys for doing that.
Great.
All right, so moving on, this is Luke Ertl again. Moving on to speak about the last two departments in our division. The department that's near and dear to my heart that I work mainly with is State Affairs. And what we do with, or we mainly work with PCAs, supporting PCAs in a variety of different ways. We do a lot of we provide a lot of training and technical assistance on a variety of different topics. We convene meetings to discuss policy issues, but those are the main two ways that we work with PCAs. And we do that, we convene these meetings either at our conferences. For example, we do some different meetings on payment reform, workforce issues, Medicaid expansion is one of the big topics that we work with a lot, and a variety of other policy issues on the state level. We don't so much as push any agenda, specific agenda. We are more, or we act more as a resource for the PCAs across the country. Some of the other things that we do is we provide other resources like writing briefs on a variety of different policy issues like health homes or medical homes, telemedicine, trying to think of some other examples, state funding, things like that, that we provide these resources to PCAs. So moving on to our last department, policy research. Good way to sum up what policy research does is they provide the gas for our policy engine. One big example of what they do is they, every year with the UDS, we get a copy of it from HRSA, and our policy staff crunches the numbers, provides resources, state fact sheets, different briefs, and different one-page resources, things like that, to show the importance of health centers, to show some breakdowns of patient populations and things like that across all the states. Variety of different things that they use the UDS data for to help push our federal policy agenda in some of our states. Some of the other examples of what they work on, some big projects. We have the PREPARE project, which is a social determinants of health project that a lot of our research team works on. What they do is, or a little bit more information about this project. It's designed, or the objective of it is to help community health centers and other providers assess and address the social determinants of health by creating, implementing, and promoting the protocol for responding to and assessing patient assets, risks, and experiences, or PREPARE. They're looking beyond the medical acuity to identify patient risks related to social determinants of health, and PREPARE positions health centers and other providers to better understand and manage their patient populations. And then finally, one of the big projects that they work on is a workforce survey it went out in December to PCAs around the country to help push it in all the health centers all around the country. But what they're looking at here is it's a national survey on health center clinical workforce vacancies, recruitment, and retention. That went out to all the CEOs of all 330 funded health centers in the U.S. And what this data will really help NACC in pursuing a federal workforce policy agenda to maximize and optimize health center clinical capacity. So with that wraps up everything on our division. Any questions?
Great, thank you guys. And I don't see any questions in the chat box at this point, but you guys feel free at any point to type your questions so that our presenters can get to it, and you don't have to wait till the end and forget what your question is. So now we're going to move on to Liz Zepko. Thank you guys, by the way, Luke and Alyssa, so much for doing that piece and tag teaming it. It was awesome. So now we're going to the Training and Technical Assistance Department, which is outside of the DC office and our main office in Bethesda. And Liz Zepko is going to give us an overview of the department she works in there.
Thank you so much, Alex. And folks, thank you for joining us today. Just want to touch base a little bit on our Bethesda office. We did not include this slide, and Russ will be just following right behind me with my presentation. So again, our office is located in Bethesda, Maryland. I'd like to call it the main campus. NACHC has, I think, just over 105 or maybe 110 employees now, and about 80 are hosted in this specific office. So who are we? Who is the Training and Technical Assistance Department? So our department has about 12 different employees with various titles and topics. I like to say in each department or each facet of your health center, there's a knowledge or an expert in our department. So as you can see, everything listed out underneath of our umbrella, we've got our Associate Vice President and our Deputy Director that really holds down the fort here. We have a specialist in governance and human resources. We've also got a leadership and development program. We focus in HIT, so a lot of about your EMR and EHR systems. We've got folks that really deal with new grantees, so any 330, if you've received a new grant, again, you are welcome to speak with this individual. What I focus on, and the next director that I'll be talking about, focuses on financial and operations of your health center. We also have a specialist in our knowledge management system. I'm not sure if anybody has gone on to our MyNeck Learning Center. Again, I'll be going over that in a few slides just to describe that. So this little chart that I've put up, I'd like to say that everybody is well-rounded in our department, and we really touch on a lot of different topics, again, that happen in the health center. So again, if you can see, at the conferences primarily, we do a lot of different educational sessions that are, again, normally 90 minutes, maybe 2 hours, just focusing on governance. We also touch on human resources. We variously have webinars that go on throughout the year in different HR topics, clinical leadership. Those are really towards the C-suite of your CMOs and your health centers. We host various trainings throughout the year just for CMOs, a 4-day-long course that's really intense. But if we have any CMOs out there, definitely would love to let you know about that. Again, what I focus on in our finance and operations, we host about, I would say about 12 to 20 different trainings a year just based on the finance and operations of your health center. We also have health information technology. Again, we host about 6 different EHR user groups. These are just resources that our department has throughout the year on a monthly basis. Our vendors that we work with throughout the year include eClinicalWorks, NextGen, GE Centricity, Greenway Energy, and also Greenway Success EHS. And we're also working with Dentrix and a few other programs. So if you use any of those EHR systems out there in the field, would love to talk to you more about that. Again, free resources to get you more acclimated on that. We also provide technical assistance throughout, all over in all facets. So how the program works here is basically you'll submit a form to our department letting them know what technical assistance you may need in your health center. We go through a process and we pair you off with consultants that we work with very closely to complete that task. To round off everything is our knowledge management system, our MyNeck Learning Center, which I believe is the next slide. This is a free resource. If you go on to, again, mylearning.nac.com, you'll just log in underneath of your 6-digit IMIS ID. I like to call it your username. It's most likely the same thing for your password. Here's the splash page you can see up on the screen. There's different publications, webinars, just resources, documents, everything that you need to know, maybe a little bit about NAC. As you can see, when you go onto that homepage, there is a search box. Again, if you put anything into there, we call them buzzwords here. Type in 340B, there's going to be webinars and, again, publications, resources all within. It's just going to, like, ping you to that. Some resources, there's a minimal fee associated with it, but I'm sure most of you have shopped online before. It's the same concept of getting in, adding this to your cart, and just self-checking out. Again, I would encourage everybody, if you want to learn more, I would just start off here and go on to the Learning Center. Everybody in the organization uses this platform to store their information, so again, check it out. So who am I? I didn't introduce myself. I introduced my department, but who am I? Again, my name is Elizabeth Zepka. I'm a program associate here in the Training and Technical Systems Department at NACC. I joined NACC in June 2013. I've got about 8 years of experience in management, including primarily retail management before I transferred over to healthcare. Before I joined NACC, I did work at a private practice focused on orthopedic surgeons back in Annapolis, Maryland, and somehow found myself in the district. Just randomly found NACC one day. I'd like to tell people that I enjoyed my for-profit work, but I felt like there was something in there that just wasn't fulfilling, and somehow I had lost my insurance, you know, before they had changed it over to the age of 26. So again, I found myself as a young college student, no health care, you know, how can I receive care? And that's actually how I discovered community health centers, just by searching in. I think I searched free clinic, which I would encourage you all back in your health centers to search put that into Google. You'd be surprised about what comes up for your health center when you type in free clinic in Annapolis, Maryland. Again, my time spent in management as well as in the private practice was based on operations. So I managed front desk operations as well as the flow of the provider schedules with the MAs. So again, worked with a lot of people back in that center. Right now, I focus in program management for regional trainings that happen throughout the year and the department's webinars. So our department hosts various trainings. Again, these are different from the conferences. Those conferences that you see marketed online, the PNI, the FOMIT, the CHI conference, those happen obviously once a year, but our department does hold individual 2 to 3 day trainings throughout the year in various topics: finance, operations, clinical leadership, HIT. Again, those buzzwords from our department. We host, again, 2 to 3 day trainings at a minimal cost versus attending these conferences. The great thing about these trainings are, yes, some trainings, those level 2, level 3 trainings that we do host are typically for those C-suite members, but those level 1 trainings really apply to anybody in the health center. So depending on what your role is, there's most likely a training that we offer out there in the field that you can attend. Just last week, I just got back from Tampa, Florida, where we held our level 1 practice operations management course. One of my favorites, because again, I have a strong operations background, but I would love to tell you more about that, again, when we wrap up today's webinar and let you know, again, about what resources that we have that maybe I might see you out in the field. Again, as you see, that I'm also co-chairing the Young Professionals Leadership Exchange. There was a switch last year, and again, I've been with Alex and Russell for a few months now, and we've really been talking about how can we improve this program so it isn't just a reception when you go to this conference. How can we make this exchange a year-long process and really getting folks involved? As you can see, there goes a few photos. Again, I hosted 20 different regional trainings last year. I met a little over 1,500 people, individual people throughout these trainings. Again, 2 to 3 trainings. We travel all around the U.S. We might be coming to a city near you. Again, so program management based on that. If you'd like to hear more information about our future training and technical assistance, I would highly encourage you to visit our webpage. There it is. You can see the link right there. I don't think on WebEx you can't click on the link directly, but it's easy to jot down. If you go onto the NACC website and click in that gray section, Training and Technical Assistance, you'll see a splash page that has all of our department's webinars, regional trainings, again, any sort of publications that we may be publishing soon. We also include that on a splash page as a save the date or look out for what's going to happen in the future. Most of our regional trainings, we also provide CPEs with that as well. So it's something to keep in mind that if you need continuing education, that we also provide credit for that as well. And again, these are at a minimal cost versus going to the trainings, which sometimes for young professionals, they don't really have a learning track for them. So again, I would encourage you to visit our website and see what our department's offering. Hopefully everybody will visit that soon. I look forward to potentially meeting you out in the field and hopefully seeing you at one of our conferences in person so we can meet. With that, I'm going to turn things over to Russell Brown.
Thanks, Liz. And Russell, I'm passing the ball to you so you can flip your slides.
Brief but awesome introduction. My name is Russell Brown. I work with the Community Health Core Department here. I'm a program specialist, but I'll introduce myself a little bit more thoroughly later on during my session. So yes, I work for the Community Health Core. This is my 101. We're a little bit different than most departments here at NACC, where we are a federally funded program, and I'll talk a little bit more about where our funds do come from. So a little bit about the history of Community Health Core. So we were founded in 1995 by the National Association of Community Health Centers, also known as NACC. And Community Health Core is the largest health-focused national AmeriCorps program that promotes healthcare for America's underserved while developing tomorrow's healthcare workforce. The mission of the Community Health Core is to improve healthcare access and enhance workforce development for community health centers through national service programs. And the vision of the Community Health Core is to become a national service pipeline for careers in community health centers that is improving access to necessary primary and preventative care services for the medically underserved. And then we also have our website. That link, unfortunately, is not clickable, so you'll just have to go to communityhealthcore.org. Pretty straightforward, but that is our website where we have all of our information regarding tools and reports that we print out either quarterly or yearly, depending on the type of report that you're looking for. So this is our department. As you can see, we are held. The strong held is pretty much Gerard Jolly and Pamela Ferguson. They're our national director and deputy director, and then from there, it's a similar structure. We have different departments or units that each of us are specialists in, or just kind of head over. So we have Randy George, who is a director of training and program development. Gina Smallwood, who handles She handles all of our grants administration. April Holloway is under Randy George. She is the manager for training and professional development. Bethany Hamilton, she is my supervisor, and she's the manager of program policy and compliance. My fellow cohort in this unit is Rachelle Thompson. She's also a program specialist for program monitoring and compliance. And Anastasia Romanova-Soneman, she's a program specialist for the communications and public engagement. And then Kelly Perkins is also a program specialist. She handles most of our research and evaluation that we do for our program. So that's our program and our department in a little nutshell. And to give you a broader picture, since we are a little different than most of NACC departments, where we get our funding is we primarily get our funding from the Corporation for National and Community Service, also known as CNCS. It's a federal entity. And what we do is we run on a 3-year grant cycle in which we have to apply every 3 years in order to get funding for, the following 3 years. So right now we're in the last year of our 3-year cycle. And what happens is when we apply, NACC receives that. They're the grantee of those funds. And then we are essentially a pass-through in which we provide the federal dollars to either community health centers that are standalones, PCAs, or health-controlled health center controlled networks, and they're all throughout the country. And then from there, these sites, whether we provide them with members, or they choose their members to go out and do the work that they're doing for Community Health Corps. And we call these sites placement sites. So they can be under the umbrella of the PCA or the HCCN, or they could be at the actual Community Health Center that is a standalone. So that's the general structure of how Community Health Corps, where we get our funding, and then what essentially happens once it gets through NAC and into the, on the ground with the PCAs, the CHCs, and the HCCNs. Okay, so what we do. So on the ground, Community Health Corps, like I said, is an AmeriCorps-funded program that places 535 members in 38 different program sites. That's what the terminology we use. Those are also known as community health centers throughout the country. Community Health Corps AmeriCorps members serve a minimum of 1,700 hours, providing direct service to vulnerable populations. Members participate in activities related to health insurance enrollment, health education, community asset mapping, outreach and patient engagement, and social service and patient registration efforts. Members are required to focus in 3 key areas of performance measurement. Those areas are financial health literacy, access to care, and independent living. And at the end of a member's term of service, if all requirements were successfully met, a member will receive the Eli Siegel AmeriCorps Education Award, which is an award that can be used to paying off qualified student loans, or could be used to for future schooling. What we do at the national office is we provide direct intensive training to program coordinators, who are the people who are running the programs at these program sites. And we provide them with intensive training through monthly support calls and on-site visits. We also develop and facilitate an annual training and program development conference for our sub-grantees. So that can include program coordinators, it can include CEOs, it can include the program coordinators' direct supervisors, new program sites. It's a really comprehensive kind of group that we could get from individual health centers or PCAs. And we call this the Program Development Institute, or PDI. What we also do is we construct policies and procedures based on federal regulations. Because we are getting federal dollars, we have to make sure that we are in compliance with the federal regs. We also construct policies based on organization feedback, whether that's from NAC directly due to their policies, or from getting feedback from our program coordinators, members that are working on the ground, and we can implement and change those policies and procedures to better, serve them and the patients that they're interacting with. And also, we also do when we do evaluation reports, we do those on a yearly basis. And so whenever those evaluation reports come out, any discoveries that were made that could improve the program, we also implement those in the changes for the policies and procedures. We monitor all 38 program sites by administering desk audit reviews. We also do compliance-based sites visits. That's something that I do as a program specialist. And we also conduct member interviews. So we're seeing, how the federal dollars are being used, if they're being used appropriately, if members are having a transformative year of experience. And then lastly, we compile and analyze all data related to our performance measures to better enhance patient interaction and AmeriCorps member comprehension, which also adds to some professional development opportunities as well. And I'll talk a little bit about that later. Okay. Our impact. So community health members, Health Corps members, this data that I'm going to be reading was from our last evaluation report. So it was actually looking at our program years of 2013, 2014, and some of 2015-16. So this is the most compiled data and information and impact that our program has had. So for community Health Corps members, they've helped 40,000 individuals enroll in health insurance, benefit programs, and services. They provided an average of 35,000 economically disadvantaged adults with education about the impacts of health decisions on economic opportunity, and they connected over 14,000 seniors and people with disabilities with community-based services and programs to help them live in their own homes. So another thing that we're doing in regards to performance measures, we're looking for a change of knowledge. So the next series of statistics are related to that. So 75% of the individuals who were engaged in enrollment activities reported increased knowledge about the effective use of those preventative and primary care benefits and services in improving their health status. 75% of adults who were provided education about the linkage between finances and health decisions reported increased financial health literacy. And lastly, nearly 60% of seniors and individuals with disabilities reported increased knowledge about the available community support services and programs. So that's just a brief impact of what our program has done over the course of 3 years, and that was just looking at, just those stats and data that we've collected from members doing their direct service within the communities that they're serving. To give you some updates, we just submitted our AmeriCorps grant application for continued funding for the 16 through 19 program year. We also celebrated our 20th anniversary. So on our website, we do have a 20th anniversary report, and so you can see from this on the slide that it is a link, but like I said, go to communityhealthcorps.org and you will be able to see the report. It's right on the front page. We're going to be releasing our impact evaluation report, which will be coming this spring. And just to give you some highlights from that report, AmeriCorps members that participate in a year of service in Community Health Corps have stronger intentions to pursue employment in community health or in a community-based setting than someone who has not yet experienced a year of service. More than 50% of the Community Health Corps AmeriCorps members begin or continue their education in community health after completing 1 year of service. And then 1 year after completing their service in Community Health Corps, 40% of alumni reported working part-time or full-time in community health. So those are some amazing statistics because one of our missions and our vision is to create the workforce for tomorrow. So a lot of these young professionals who typically come out of college, that's the general age of our members, anywhere between 18 to 26. They come out of college and they're interested in, getting their hands dirty essentially and going out and getting involved in their communities and getting an experience and really making an impact through direct service. So what happens is they had such a profound impact that they actually want to stay with that, and they'll pursue either medical school, dental school, or they'll actually get accepted onto the community health center as a full-time employee, which is amazing. And last but not least, HR 2029, the Consolidated Appropriations Act of 2016 was signed by President Obama, providing an unprecedented $1.1 billion for national service programs, which include AmeriCorps programs. So that was recently just signed in, and so that definitely increases the capacity for AmeriCorps programs and focuses on national service as a means to creating more specifically related to community health, is creating, obviously economically making sure that the healthcare spending is decreased, but also to increase people's access to preventative care measures rather than always focusing on ER admissions, et cetera, et cetera. So this is me. This is Russell Brown. I joined NACC in 2015, January last year, so it's been my 1 year anniversary, recently just passed. Before NACC, I worked as an HIV tester and medical case manager with youth and young adults at the Martha Elliott Health Center and also Boston Children's Hospital. I was actually a Community Health Corps AmeriCorps member in 2012 with the Massachusetts League of Community Health Centers, and I was hired on as a full-time employee at the Martha Elliott Health Center after. And I am also a co-chair for the NACC's Young Professional Leadership Exchange. All of my information is on the left-hand side. And if you're interested in Community Health Corps, feel free to ask some questions. My email address is there. And yeah, so that pretty much sums it up. And I think up next will be membership and marketing. So Zach.
Thanks, Russell. Appreciate it. Hopefully everyone can hear me okay. I'll take off speakerphone. That is on the side. Myself and Daryl Northrup, my coworker, is also on the line. So you've got half the department. The other two that round out the department is Keisha McConos, and then our Associate Vice President of Membership and Marketing, Maurice Denis, which I can't imagine a single person in the health center movement that doesn't know him. He's very good at networking and saying hello to everybody at all of our conferences. So Real quick, I mean, our primary task is growing membership. Kind of extra little caveat to that, though, we're also sort of, due to the fact that we're quite often, you know, the people that get the most interaction with the member early in their membership, we're kind of a concierge, if you will. So others in NAC get weird emails from us like, who in your department would handle ... And we do our best to connect the services that NAC offers with the members that we have, or potential members that we have. It's not just health centers, though, that are members of NAC, and Daryl can elaborate a little bit on the various membership types that we have. Daryl?
So here in the membership department, we try to reach out and engage and gather members from all facets of the community healthcare movement, and that, of course, includes the community healthcare centers, our organizational members, and that's really our flagship membership category. That's who we focus on. That's what the National Association is about. So our organizational members are the community health centers, and their membership gets them a vast array of benefits, everything from discounted trainings and manuals and training materials to they get discounted registrations at our big conferences. Of course, the P&I conference is coming up, so that's certainly one of them. And then when we're interacting with them, we let them know that as part of their membership, they have access to basically everyone at the association. So if they have an issue, we want them to call us, because chances are someone here has dealt directly with the issue, or we've put together a training piece about it, or there's a webinar that's been recorded about it. So we want to be their first source that they turn to when an individual health center has an issue. They can come to us, because the more support we can give them, the more likely they are to support us. It's a virtuous circle that goes around. So one of our other types of memberships are the associate memberships. They're open to nonprofit primary healthcare organizations that are committed to the types of goals that NAC is committed to, but that are not, don't meet the criteria of organizational members. They're not federally qualified health centers. So free clinics, organizations of that nature, nonprofit institutes that study healthcare are often our associate members, and they also are able to attend the conferences and support the movement. They have access to members-only section of the website, as well as discounted training and educational materials. And we also have the corporate members, with nearly 1,400 community health centers and 9,000 sites. Community health centers are an incredible economic engine. They provide, there's jobs in that area, and an immense amount of physical material that has to be supplied to the clinics. So everyone from folks offering text messaging platforms for community health centers to stay in contact with their patients and send them reminders to take their diabetes medication, to medical equipment distributors, to office supplies, everything that goes into the nuts and bolts of making a community health center run. We reach out to corporate partners who want to support the community health centers, and they're able to get better access and better understanding of the community health centers, because a lot of companies will approach community health centers just trying to make a quick buck. And the community health center, it's a big movement, but it's also a small movement. Everyone knows everybody else, and the health centers feel more comfortable with corporate partners that they feel understand the movement and understand what the community health center needs and what their patients need. And so corporate membership is really a great pathway to get on board with that. We also have individual membership. Individual members who work for our organizational members, the community health centers, they're able to serve on the various committees and boards that provide the direction that the National Association takes. Here in the membership department, we work a lot with the membership committee, And these are folks that are active in the community health center movement. Many of them are currently working at community health centers and leaders at their own health centers, and they help guide us and make sure we're going in the right direction to support the membership. So individual members, of course, they're signed up for our electronic mailing list. They also receive an individual annual subscription to NACHC's bi-monthly Community Health Forum magazine, and it's a way for them to, for individuals to hook into the National Community Health Center movement. So that basically sums up the different types of membership that we have, and I'll let Zach take it from there to kind of sew it all together.
Sure. I think a really good thing that we would, or a really great benefit we wouldn't mind from said networking with everyone here, the big challenge that we face as membership and in most trade associations face is value in your membership. I think the folks on this call completely understand the value of NACC and the advocacy work that NACC does and where the membership dues go towards that. I think that we kind of run into the same problem that PBS runs into, so kind of just throwing it out there, and if anyone has any ideas, feel free to email us on the side and we're chat here. But yeah, you listen to PBR, NPR or watch PBS for free, and the programming is always going to be there. Health centers are very likely always going to be there. NACC's very likely always going to be there, but how much better can NPR be, and how much better can PBS be from viewers like you? So getting some health centers to understand that their neighbor health center is perhaps paying the dues that they benefit from, and so on and so forth. It's been a struggle for us, and at times, and we're hitting a whole new generation of CEOs and COOs, evidenced by this group right here, that didn't necessarily grow up with the growth of the health center movement and don't realize what came before them and the shoulders of giants that we're all standing on right now. So any insight, any kind of young professional, and dare I even say millennial insight onto how to make that case, we certainly would be very welcome to any advice, because we hit our heads against the wall occasionally on that. So that's kind of just where we are as membership, and great summary of our benefits and membership categories. Really goes to show you that there's quite anyone can join NACC. You don't have to be a health center. So always something to keep in mind for those of you that aren't at a health center.
Great. Thank you, Zach and Daryl, and thank you to all of our panelists for taking some time to share a little bit about what you're working on and what your division does, and sort of how you form a really important puzzle piece in the NACC puzzle. So hopefully you guys who are on the webinar got a better idea of what NACC works on, and sort of, especially some of the young professionals, how we're involved in NACC. Obviously, we're not all young professionals at NACC, but I do want to reiterate that, even though we do call this the Young Professional Leadership Exchange, it's all about being young at heart. So, if we don't have an age limit, we don't have any criteria like that. If you're interested in this subject, if you're passionate about it, if you've been through a lot of these issues and you want to be involved and give your feedback about what you've gone through as a young professional, whatever your interest is in this subject, we want you to be involved. So, making sure that you guys don't feel like the young professional thing is restrictive in any way. I don't see questions in the chat box, so I'm going to open it up again and say, please, if you have questions, go ahead and type them in the chat box. And also, if you have any suggestions or feedback for us, for any of the departments specifically, but also just for the Young Professional Leadership Exchange, we'd love to hear your feedback, so definitely don't be shy. And if you don't feel like typing it in the chat box, you can always reach out to us individually. Our contact information is on our website, NACC.com. But also all of our email addresses are our first letter of our first name followed by our last name at NACC.org. So we're pretty easy to find. But yeah, I'll open it up one more time for questions. and I'm not seeing anything, so I'm just going to say thank you one more time for taking time out of your busy Monday afternoons to connect. Just a heads up, we are hoping to do more stuff like this and really just connect more often. Obviously, we have the P&I coming up, and our reception is coming up at the P&I. So if you are going to be in DC for Hill Day, or for the Policy and Issues Forum, or both, please definitely stop by, grab a drink, grab some snacks, and let's meet in person so that we can get to know each other better, understand each other's issues, and, you know, at least have a little camaraderie going on. But beyond that, beyond the receptions, we are hoping to just continue getting feedback from you guys about what, you know, things NACHC could potentially do to help facilitate professional development in the health center world, but also really just to build this network so that, you know, we get to know each other, we become closer, we understand, you know, what each other are going through and can help each other out in our career advancement in this world that we're all really passionate about. So, you know, again, just building the network, thinking of new ideas of ways that we can sort of get to know each other and things that NACHC can provide. What we're looking for. So, you know, like I said, we'll probably be sending you guys emails in the future about calls and webinars and other events. But in the meantime, like I said, P&I Friday, March 18th at 6:30, petite slots, or however you say that. I don't speak French. We hope to see you there. So thank you guys so much.